At the Mississippi Office of Nursing Workforce, we understand the need for our nurses to have solid, fruitful careers. We constantly work to resolve issues around nurse retention and to serve our ongoing mission. Working creatively with funders and healthcare partners, one of our most successful recent efforts has been a series of programs to help healthcare workers move up their ladder of success. The initiatives have begun with promise and have met high expectations.
We have a project in Mississippi where we are working with frontline workers in healthcare facilities. And these frontline workers are staff who work in dietary, transportation, some of them work in the nursing department, some of them work in the environmental services, housekeeping. They're folks that have worked in these facilities many years. They have probably never really had an opportunity to go back to school and get additional education where they will have opportunities for increased pay, recognition, certificates, and then even move forward toward college credit. So through this project, we are able to take several hospitals and healthcare facilities in the state and let the frontline workers apply to go back to school, and then in partnership with Hinds Community College, we're giving them special training, counseling, and then helping them as they navigate through the system.
The Office of Nursing Workforce came to us and asked CMMC to participate in a Jobs to Careers grant for frontline workers. Within this grant, there's funding. We're working with our alliance with Hinds Community College, and it is taking frontline workers to unit secretaries. There are employees from every area of the hospital almost involved in this grant. And this grant is allowing them to go back to college while still being at work. They're actually paid for their work time, their school time while they're at the hospital.
One of the grants is from the Mississippi Department of Employment Security, and the other grant is called a Jobs to Careers, and it is funded by Robert Wood Johnson, the Hitachi Foundation, and Jobs for the Future.
When the students come to us, the first thing they have to do is to go through the application process, and that in itself is sometimes frightening for the students, so we assist them in the application process, and then they do have to obtain their high school transcript or GED scores. They also have to take a compass reading test if they didn't take the ACT when they were in high school. And that is given here on our campus, but in this project we're able to actually go to the agency or the hospital and give the compass test on site there. That makes it a little bit less stressful for them if they're having to take a test for the first time in a long time. Then they can take a web-based learning remediation called Plato. And that program is one that we offer here on our campus in our computer learning lab. But they also can access that from their home.
The enthusiasm for this program at St. Dominic Hospital has been tremendous from the beginning. We are so interested in work-based learning, and my initial thought was to check with our management team and see what their thoughts were about it. I introduced the program and asked them, did they have anyone in mind in their areas that would be a good candidate for the program, and immediately everyone in the room raised their hands. So with that, I knew we had what we needed to be able to make it a success at St. Dominic.
We had been discussing in my organization the possibility of growing our own nursing assistants, and we didn't really know how to approach doing this, but we thought it was a great, at least conceptual idea. And then, we wanted to be able to develop nursing assistants that were the quality of employee that we wanted in our organization, number one, and also number two, someone that we felt would be loyal to our organization and would want to stay there for a considerable amount of time. So then I was able to get involved in the Bridges to Career grant through some affiliations with the Office of Nursing Workforce, and this has just really fit right into what our organization wanted to do.
Yes, we have CNAs who actually work full-time for us and go back to school to become LPNs, and then also I have numerous LPNs that are going to school to become an RN. And we like to see those nurses that are advancing in their degrees stay with us even when they graduate and become a licensed nurse or a registered nurse.
My mother was in the LPN program here at Hinds, And during her year of study at school, I learned a lot from her. I helped her with projects and homework that she had, and I oftentimes found myself picking up her book to look at some of the parts of the body, the human body. And my son got diagnosed with diabetes during that year, so we had to get together to learn a lot of things about diabetes and how it works and how it plays a part in my son's body. He was only 13 months old. I went back to nursing school, RN program bridge at Hinds also. I worked a full-time job with 2 kids and I made it through.
It helps with skills just in the health facility, health industry, just learning some of the basic things.
In the position that I am, in the department I'm working in, it's not really a lot of room for change and moving up. But with taking this course, it would help you get transferred to a different department and make, we'll get a better position.
I looked at it as an opportunity to move up, opportunity to go into something new, to explore my opportunities, to find something else that is new other than transportation.
In my department, it helps me be more than just a secretary when we have patients coming in my department.
Through part of the program, a bridge is provided not only to those currently in the workforce, but to those making career choices as early as high school.
The education we're focusing on with these high school students is the dual enrollment program for practical nursing for high school students. This is an innovative idea that has been brought to our state, and our community colleges are implementing this program. Currently we have 9 community colleges participating, and what is happening is they're recruiting high school seniors to begin their curriculum for the practical nursing program during their senior year in high school. Upon graduation from high school, these students are then eligible to pursue their certified nursing assistant licensure or certificate, so they have a credential that they could stop and enter into the workforce there if they needed to. These students that started in their senior year enter in the community college practical nursing program in the summer right after they graduate, and they graduate with these students in December of that year. So 6 months after they graduate from high school, they are educated and are eligible to sit for their board exams and become LPNs that soon, and have an open door into a wonderful career. Also, we give them some information through our Student Navigator, which is a website with resources to help our students stay in school and be successful.
The person so far that's learned the most from the experience is me. So I can almost say that I've been back in school, and it's really been a very great opportunity.
And it gave us a chance to basically do more and to be certified, which will help us in the long run if we decide to go on to school.
And we've identified Itasca as one of the recipients of the program that completed it successfully and did a wonderful job, and has such enthusiasm for it, will help us with our next group.
We have anticipate that we will train probably between 30 and 40 frontline workers in the first year, and they're very excited, as well as the facilities they work with.
We've seen the difference that can be made by a little focus and a lot of hope. As we continue to employ practical, action-based solutions like these, we at the Office of Nursing Workforce continue to invest in the future of nursing.